Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. We're taking your calls at 866-870-5752 right here in the studio. That's 866-870-5752. Check out the website at www.lastemcells.com. That's www.lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on videos. And when you call the program today, you get Dr. Darrow's latest book for free, Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. It has over 264 scientific studies. And right now we're talking with Margaret.
Margaret, Dr. Marc Darrow, bear with me for 1 second. I just want to give a little leader to this show of what's going on. So what I've been doing for 20 plus years is healing musculoskeletal pain. That means neck, back, arthritis, all the joints from the neck down to low back, anything in between, hips, elbows, fingers, toes, ankles, knees, you name it. So we're dealing with your right knee right now. You're telling me that you had a sciatica type problem. I'm assuming that, and I don't know the answer, I don't know if anybody does, that you were walking a little bit off because of the pain that was going down your leg. And then you somehow or other, because of that, irritated your right knee. And your doctors were talking about giving you a cortisone injection, which I detest. I don't think you should do that, but I'm not your doctor. The cortisone can destroy the cartilage. It can upset your adrenal axis. I've seen people go into early menopause and things like that from it. So it's not the kind of drug, although it's used ubiquitously in traditional medicine. They even give it orally, which can actually kill the hip, the bone in the hip. It causes avascular necrosis, and then you have to have hip replacements from taking it orally. So I don't like that medicine. I don't think I've ever given it once to anybody for orally. I have had to do a few steroid shots or cortisone shots when someone was red hot. Let's say with low back pain, they couldn't stand up. And when you do that in 1 minute, they're back up. So it has its purposes, but you have to be careful. It's not good to put into weight-bearing joints because as it softens the cartilage, if there's weight on it, it can wear it out even sooner. So I'm going to look at my notes here on what you talked about because you gave me a lot of information. Number one, sciatic pain is typically pain that goes down maybe into the butt or down the leg. And yours went away, which is very typical. I forgot the percentage, 97% of them go away on their own without a doctor. So when someone comes in with that and it's fairly new, I don't send them to a surgeon, okay? We try to work with them and get it healed up. So like I said, a humongous percentage of the sciaticas went away and yours went away. What else did you talk about? You went to a chiropractor, which is great. I love chiropractors. They're, fairly conservative for the most part. I don't like when chiropractors are hustling their older patients to do stem cells and charging them a fortune to do it. They usually bring in a doctor who doesn't even know what they're doing. So nothing against you chiros, because I love you, but the guys who are out there to make a buck by hustling patients, I'm not in favor of. I just have to say that. So, if you're going to get stem cells, go to a guy who's an expert in it, who does it all day long. Don't go to a chiropractor for stem cells. The ortho said prednisone a no-no, but cortisone okay. No, prednisone and cortisone are the same, okay? It's a different configuration maybe, but they're both very strong cartilage dissolvers. And I don't like when people have to take prednisone. Some people have to because they have some terrible inflammatory disease. I understand that. But again, Margaret, what I got to do is I got to get you in the office. If you want to come in, the number is 800-300-9300. We usually have people by the phones, even if you called now, and you can find out more information. And if you come in, I can touch your knee. I can look inside with an ultrasound. I have an ultrasound, which is diagnostic ultrasound, not the type that heats the body up, the type that looks into the body. And there's a good chance in about 20 seconds I can tell you what's going on. So, and whether or not we can help you. Most likely, from what you're talking about, there's nothing terrible going on with your knee. You just sprained something from walking a little off from the sciatica that went away. Any other questions, Margaret?
No. No. You've been very helpful. Just repeat the number so I can.
Yeah, the number to the office is 800-300-9300. 800-300-9300. And for those of you listening out there, if you want to talk to me right now, like Margaret is, the phone number to the studio is 866-870-5752. I'll repeat it for you. 866-870-5752. I'd love to talk to you.
Thank you for your call, Margaret.
Thank you. Bye-bye.
Our number again, 866-870-5752. That's 866-870-5752. We still have time left for you, so don't wait till the last minute. And we have Pam and Van Nuys.
Hey, Pam, can I tell a quick joke? Maybe you know the answer. How do you stop a bull from charging?
Close the gate.
I don't know.
Cancel his credit card.
Okay.
One more to get the laughter going. Why did the mushroom go to the party?
Why did the mushroom go to the party?
'Cause he's a fungi.
Oh, my God. I should have known that one. You say that one all the time. Oh, we lost out, Pam. We don't get the prize. It's all right.
That's okay. Just listening to me be a dummy is fun enough, isn't it?
Well, there's that, yes.
All right, so Pam, your friend's son has bone marrow issues. Can stem cell help? When you say bone marrow issues, does he have leukemia? Does he have lymphoma? What is it?
But apparently they're afraid. He's 13 years old. They want to do a bone marrow transplant.
Okay, that's a different story. What I do is musculoskeletal work. That's the bones and ligaments and tendons, joints, things like that. Oncology is a different field of medicine totally, which I know very little about other than what I studied and worked on during my training and internship and residency. We had a lot of patients with that. But I've been out of my residency since 1998, and I don't treat that, okay? So the way that works, though, very simply, is they take out, well, there's many ways they can do it, but they can do a bone marrow transplant where they can irradiate the bone marrow that they take out and kill the cancer cells and then put it back in. So that's not something I do. Even me saying that, I'm not probably saying it the right way. I do musculoskeletal, what we call orthopedic medicine, using regenerative medicine of using stem cells from the bone marrow and platelets from the blood. Okay, so it's a whole different thing. So so I'm not the guy to ask. Let me ask you something. Do you have any?
Well, I've always been so impressed with your program and with you that I was hoping you could fit in some way.
Yeah. Well, I can fit in some way if you have any pain. Do you have any pain in your body, or have you?
I do not, no.
Wow, you're a lucky one. Anybody in your family? Any friends?
Actually, no.
I want to be your friend then.
I want to adopt you too.
Anyway, stem cells
Oh, dear.
that I use from the bone marrow are injected into the areas of the body where it's broken down, where there's pain, where there's neck pain or back pain or arthritis or shoulder pain, rotator cuff issues, meniscal tears in the knee, toe pain, arthritis, or bunions is really arthritis. People have that little lump on the inside of their big toe, and we can inject that
Okay.
and everywhere up the body and down the body.
Okay. Well, I was so impressed when I realized stem cells were involved in this, and I thought of you because you're synonymous with stem cells.
Well, I've been doing a lot over the long time, and I've been told I've done the most of anybody on the planet. I don't know if that's true or not because I don't do comparisons, but I do know when I go to workshops on this stuff, doctors come up to me and go, "Oh, you're Marc Darrow? Oh my God, how do you do so many?" And I tell them what I do, and I actually train a lot of doctors. I've had doctors come to train with me from all over the world because I've done so much of it. I've got it down. When we do a bone marrow aspiration, once I numb up the area on the pelvis, it literally takes me under 15 seconds to do the procedure. We have an amazing team of medical assistants that help me. And, a lot of people have come in and they go, "I had stem cells with Dr. XYZ. It didn't work. And they put me in a hospital to do it, and it cost 20 grand and blah, blah, blah." And none of that's necessary. That's building up and making it dramatic, and it's not. It's so easy to do. It's like drawing blood from the arm.
That's interesting to hear. Very interesting.
Anyway, I'm so happy that you called. You're an amazing person. I love you very much, and I appreciate your care for your friend's son. And I think he's going to be fine, and the procedure is a good procedure. Most people do really well with it.
I sure hope so. Thank you so much for taking my call.
Thank you, Pam.
Thank you for your call,
God bless
Pam.
you.
Thanks.
Our number is 866-870-5752 right here in the studio, 866-870-5752. She was delightful, wasn't she?
Wasn't she sweet? Yes.
Very.
So go ahead, Nita, and then I'll take over.
You still have time to call and speak directly to Dr. Darrow, and you get his latest book for free right here, right now, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies. So if you want to read it, call. And you can also go to the website and watch Dr. Darrow performing the treatments on videos at www.lastemcells.com.
So I started out the show with a question that came in through my website. I never got to it because we got some callers right
we
away,
did. Yeah,
which
go
is
for
great.
it.
I mean, I'd rather have callers than read questions, but we'll get the information to you guys one way or another. So this one says, "Hi, I'm an amateur athlete with a labrum shoulder injury caused by several dislocations. Looking for a doctor with experience in sports injuries. Please let me know if you can help." And then I won't say your name. Yes, we do these all the time. I've had people who dislocate their shoulders every single day. And we have tightened up the ligaments around the shoulder and the tendons. The rotator cuff has 4 tendons, and we just inject all around it. We inject into the joint, we inject the labrum, and those shoulders just tighten right up. I've even had patients with multiple shoulder dislocations that continue to dislocate even after a capsular surgery where they tighten up the capsule. So I can't promise you it's going to work on you, but it's worked so far in every one of these I have done. And a labral injury is not necessarily something that causes pain. The labrum means lip in Latin, and it's a lip around the humerus bone that helps hold the bone into place. There are studies that show that people with labral tears don't necessarily have pain. So we don't want a surgeon cutting out part of the labrum if it's not really the problem. And most people with labral tears we can help get better. The dislocation thing shocked me the first time I did it because I told the patient, I don't even know if this is going to help. Most of regenerative medicine I've learned on my own, just by experimentation on my own body. And as you guys who know me understand, I've injected both my knees, both my shoulders, my right wrist, both my elbows, and I've had other people do my neck and back, and my ribs. I had some broken ribs, and I've had every rib on my back injected. I laid on a table one time for about 2 hours getting injections because my back was so beat up from gymnastics and other sports. And, I came out good. So it's something that's very hopeful. This line of medicine is becoming very popular. Surgery is becoming something that people don't want to do anymore. They have friends who have had surgeries, or they've had it themselves, like me on my shoulder, where it failed miserably. I'm not saying surgery is not something to do, because there are cases. I mean, if you break a bone, you should get surgery. There's a lot of things you should get surgery for. If you have a herniated disc that is pushing on a nerve and you can't move your leg, it's numb, there's a good chance you need to have that excess disc material removed. So, I'm not against surgeons. I do love surgeons. They do the hardest work there is in medicine. It's dangerous work, and unfortunately, I see all the mess ups. And the mess ups aren't necessarily because the doctor messed up. It's just that, it's human error. Everybody is different. And I get new patients come in all the time. They go, why didn't the doctor tell me that the surgery could make me worse? And I don't know the answer to that, because I hear people say, the doctor guaranteed me after the surgery they'd be better. I don't tell people that. I tell people the opposite. I go, I don't know what your future is. My crystal ball is broken.
Well, how can you give somebody a guarantee in the world of medicine anyway? It's like
you can't. And I had someone yesterday. He was a lawyer, and he kept pushing me. How many treatments will this take? I go, I don't know. He goes, but you have all the experience. You've done more of this than anybody. I go, I still don't know. You're a study of one, and you're going to be different than everybody else. I've treated mega thousands of people. I've probably done over 5,000 stem cell treatments, and probably 3 or 4 times that, or maybe more, of PRP, platelet-rich plasma. And because we had PRP before we had stem cells, and I was doing that for years, so a lot more PRP. And I never know how a person's going to turn out. Sometimes the worst terrible conditions, horrible arthritis, the pain goes away in one treatment. I don't know how that works. I'm just going to be honest with you guys. And then I have the opposite. I have people that we can't find anything wrong with, but they have terrible pain. And sometimes that'll just go away instantly. We just never know.
Well, you can find out more by calling and talking to Dr. Darrow right now, 866-870-5752, right here in the studio. That's 866-870-5752. And check out the website where you can email Dr. Darrow off of every page and see him performing the treatments on videos at www.lastemcells.com. That's lastemcells.com. And let's go see what's going on with Angela.
Angela, Dr. Marc Darrow, how are you today?
Hi, Dr. Darrow. I'm okay, because I usually just am the type of person who pushes through pain, because I've been dealing with it since '89. I was like a multi-trauma, and I had multiple fractures and stuff. But today, what's bothering me the most is the back of my right knee. A while back, a few years back, like maybe 5 years, I had MRIs on my knees, because I had bilateral patella fractures and stuff like that, but that's another story. But he said I had popliteal.
Popliteal cyst, yeah. Also called a Baker cyst.
Yeah.
So let me explain something about a Baker cyst or popliteal cyst.
Mm-hmm.
That usually goes along with an injury to the knee joint. And the fluid that builds up, if you come in 1 second, I can show you where the fluid is. in the back, and I can show you if there's fluid in the front. So typically, if there's fluid in the front, there's nowhere for it to really go except backwards, because that's the weakest area. So it sneaks out through the back of the knee and causes a popliteal cyst or a Baker's cyst. And what we do generally is, if I find pathology in the front of the knee, we'll treat that. And then after we treat that, we'll aspirate the Baker's cyst. Normally, when you just aspirate a joint, meaning take the fluid out, I do it under ultrasound guidance, so I can watch that needle. I can get every single drop of fluid out, and I know where I'm going with it. The back of the knee is a little bit complex because you have the popliteal artery and there's a nerve back there that you don't want to have a doctor ever aspirate a popliteal cyst without an ultrasound, so he can watch and see where those bad issues are. You don't want to poke an artery or nerve. So, and any knee injection, shoulder injection, hip injection, in my book, should be done under ultrasound guidance. The studies show that if you inject blindly without an ultrasound or a fluoroscope, you're going to miss the joint at least 1/3 of the time. Now, a lot of times people get hyaluronic acid injections like Synvisc and other things like that, and their knee will blow up because they didn't put it in the joint. They put it in the soft tissue. Then they have to get rushed to surgery to get what's called an IND, or incision and drainage. So I inject under ultrasound. I want to know where whatever solution I'm using is going. Okay? So I'd have to examine your knee. I'd have to look with an ultrasound. You could see the screen, and I could show you exactly what's going on. If you want to come in, the number to the office is 800-300-9300. I'll repeat it while you're scribbling. 800-300-9300. And probably in about 2 minutes, I can tell you what's going on, okay?
Yeah, I also have IT problems and collateral ligament problems and subluxation and stuff like that.
Yeah,
so.
none of that is an issue for me in terms of what I think I can do to help you.
Okay. Thanks so much for your time, Doctor.
You know, the white horse I ride, you might say, is saving people from surgery. I have saved mega thousands of people from needless surgeries that never should be done. Although the surgeons say they should, because if you're a surgeon, that's how you think.
Right.
When I was training in orthopedic surgery, the only thing I thought would work is orthopedic surgery. I'm just being honest. It's the religion of orthopedic surgery.
I think that's what makes you probably a pretty good regenerative medicine doctor, because you know all the orthopedic areas and everything like that. So you know the anatomy up and down. Well,
I'm not the anatomy is really known the best by orthopedic surgeons, to be honest with you, because they're opening up the body and seeing everything live. So I'm pretty good at what I do. I get a lot of great results. If you look at yelp.com, YELP.com, and put my name in, Marc Darrow, MD, you'll see probably a couple hundred reviews on me. Most of them are good, some are terrible. And unfortunately, as a doctor, I'm not allowed to respond to those terrible ones about what really happened.
Yeah. I was going to ask you, how long does rehab take? Does that book tell you, or?
You don't need rehab when you do regenerative medicine. This is the rehab. It's regeneration of tissue. You don't need to rehab it after that.
I thought you had to maybe wait a day or something before you start doing stuff.
Well, doing stuff is a different story. That's not rehab. Rehab is when you have someone who specializes in mobilizing joints and whatever. God bless you. Thank you so much. Anybody who wants to get a hold of me, call 800-300-9300. If no one picks up, they probably will. If they don't, leave a message. Go to my website, www.lastemcells.com, and you can email me from every page there. Thank you, Nita. Thank you, Alex. Thank you, Suzette.
Thank you, Dr. Darrow. Thank you, everybody.
You all.
Thank you. See you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.